first thing I would like to ask, how many of you have been in pain, taking medicines and not getting relieved of pain? How many of you? Raise your hands. Let me see. Okay. Okay. How many of you want to know simple tips to save yourself from pain, from your joint pain, from your muscle pain, back pain, knee pain? All right. All right. That's right. So, uh, I am Dr. Rajashree. I am Dr. Rajashree Lad. I am a physiotherapist. I am specialized in treating orthopedic conditions, joint and muscle pains, back pain, all these conditions. I am specialized in treating all these conditions along with the movement and posture, emphasizing on movement and posture. So, before we start, I would like to thank each one of you for taking out time from your daily routine to attend this talk. I will try my best to make, to give you maximum value out of this talk. So, starting by the end of this talk, you will be able to know or learn why do you get pain and how posture is related. I mean, posture has impact on your body and pain. Number two, which you're going to learn is why taking medicines doesn't help you relieve your pain. Number three, simple tips to save yourself from this pain. Okay, so are you ready to learn? Yes? All right, all right. So, why am I doing this talk? Having treated hundreds of patients over years with joint and muscle pains, with the back pain, neck pain, and you've got to know that posture is something which affects body a lot. It's a simple thing. Correcting posture, treating your pain and then correcting your posture. It's a simple thing, but people are least aware of it. And because of just this one thing, they spend a lot of money, time, and they suffer a lot. It's a physical suffering. It's audible.
Yes, we can hear you clearly.
Yes. So a lot of suffering. So that there's when we thought of making people aware. People are least aware of this something called as postural awareness. I recall a case, a patient at our clinic. Her name was Suhasini. She was I think 61-year-old female around. So when she came to our clinic, she had lot of knee pain, she tried everything, all the medicines at multiple places. She was suggested for surgery at two hospitals. She took MRIs, CTs, X-rays, nothing was left. She had pain while walking. She had stopped going out for around 2 years. Her pain was severe since around 2.5 years. She had been having this pain since. So when I asked her, since when do you have this pain? She answered me. So she had her son sitting in front of her. She asked him, "What is your age?" Her son told her that my age is 30. And then she said that this pain is since 30 years. I'm like, what? She's like, yes. So when her kid was 1 year, less than 1 year old, that kid was on the bed, and while rolling, probably the kid was playing. He rolled and he was about to fall. And this female, she ran to hold that kid. When she tried holding that kid, she got hit from the iron rod of the bed. Those times at her village. So that iron rod hit her knee. And since then, she had been having this pain on off. She took medicines, but then there was on off pain. She took medicines, okay, pain subsided for temporary period of time, again pain. But then, since past 2.5 to 3 years around, she has the pain is so much severe that she had to leave her work. She had to stop going out of her home. And when we got to know this, I personally had goosebumps literally. 30 years a person is suffering from pain. But we don't realize. So when we examined her, we got to know her, the way she walks is totally different. She bears weight on one of her leg more, and she has her foot turned slightly inside one foot, the painful leg foot, slightly inside while walking. Now this is her adapted posture, adapted pattern of walking. Now when we see as treating doctors, we get to know that she is walking incorrectly. When we examine her posture, when we examine the way she walks, We got to, this is incorrect. Something, she bears more weight on her other leg. Painful leg bears less weight. The painful foot is slightly inside. Painful leg foot. So this is something abnormal, but for her it is normal. Why? Because this she has adapted since 30 years. That is the pattern her body is adapted to keep her away from pain. So body always chooses the path of least resistance to make you pain free. So if walking straight or walking correctly is giving her pain, she adapted in such a way that the pain got reduced. But now, after 30 years, she has reached at a point that the body's adaptation is also over. The body also has given up. And now she's having so much of the pain that she has left no options. Whoever has said wherever go to this place, get treated here, and she's done everything. She didn't want to go undergo surgery. That's why she has that fear that if this pain will go or not. So a simple thing. So a posture, and why that posture? Because of the pain. So her pain, no, the injury which she got due to the hit of the iron rod would have healed after a period of time. But to avoid that pain at that time, she adapted that posture. And then even after that injury wala pain was gone, the posture she had adapted was same. Okay. So that impact, now once that incorrect posture, after a period of time, it started affecting her body, and then it gave her pain so much that her life was affected so much. Okay, it is as good as, for example, I can say if my head has to be straight. Okay, so if I keep doing my all activities in this position, obviously it is going to affect. Similarly, it has happened with her knee, that her knee was slightly turned inside all through these years, and then now it has given her pain. Are you getting me? Are you all with me? So कहने का मतलब ये है that posture is so much important. We don't realize. Yes, we don't realize how does it affect us, but it does. It does. And after a period of time, it causes pain. It causes us, difficulty, discomfort, and carrying out daily activities. Okay, so now I'd like to share my screen.
Yes, you can.
All right. So today, what we are going to learn is what is posture. That's number one. Posture is something that how do we keep our body, the alignment of our body. Okay, the way we sit, the way we sleep, the way we carry out our daily activities, the way we walk, while maintaining our body posture, while maintaining our body alignment is called as posture. Now, quickly, I'll let you know what is good posture and bad posture. Good posture is something in which our body and our muscles and joints are well aligned. They are working to their maximum capacity with good efficiency. Now, bad posture is something which makes our body, in simple terms, which loads our body in an incorrect way. Okay, which uses more energy, which affects our breathing. So for example, if I'm sitting in this posture, my lungs, they get less space to expand. So your lungs, they get less of oxygen and air inside. So this is how your bad posture affects us. Whereas good posture, if I'm sitting nicely, my lungs get good capacity. No, they have good capacity to expand. My digestive organs, my organs, the organs in our, your stomach, your intestines, they get good space to work properly. So this posture affects us. This posture, it helps us in a good way. Okay, so this is the difference between good and bad posture. Whereas when you have a good posture, you have a good state of mind, you feel very nice, you feel energetic. That is also an advantage of the good posture. Okay, so good posture, less energy required, you feel good, your organs work better, your breathing is better. Whereas bad posture, your body needs more energy, it affects you more, it causes more energy consumption, and it also affects your breathing and digestion. Okay, moving on to now. After we understand what is posture, let us see how does this posture affects us in giving pain, and how can it be helped, or what can be done to correct it. Okay, so first, I think the common conditions we see in our elderlies is the knee pain. Now, why do we have this knee pain? There could be a past injury. Other than that, there could be a factor related to nutrition and how do we do our daily activities? How do we stand? How do we sit? Our posture, basically. So, first thing I would like to tell you, sitting. Sitting for long is not advised at all. So after 25-30 minutes, one needs to get up and take a walk. Now, why? Once you sit for long, the circulation around your knee joint, the blood circulation, there is something called synovial fluid in the knee joint. The circulation gets affected, the nutrition gets affected, and that's how your knee joint gets less of nutrition. Now, once it starts getting less of nutrition, gradually the working of the knee joint gets affected, and after a period of time, you start getting, we call it as age related change, which is degeneration. Okay, and you start getting. Other than that, the muscles. Now your bones and muscles, they work together. Now either of it gets affected, maybe because of injury or because of any other nutritional deficiency or because of your posture, your joint gets affected. Okay, so it's like a team. Supposedly, we are playing a game as a team. Now, one member of the team gets affected, the rest of the team, one member of the team gets injured, the rest of the team gets affected. So, likewise, your bones and muscles, they work together. So, if your muscles are weak, if they don't work correctly, the joints are overloaded, and then gradually you start developing the degenerative changes, we call it as, or age related changes such as arthritis, the pain at the knee joint, and then gradually your daily activities such as walking, sitting down is affected. Now, what can be done to this? Number one, you need to get up and walk after 25 to 30 minutes. Don't sit for longer than this. This number one thing you have to take home today. Okay, will you do that? Okay. Next I want to talk about back pain. Back pain, which most of us suffer. Supposedly, if we sit for some time, or maybe after getting up in the morning, or maybe while lifting or putting something. So back needs to be taken care of. Now, how will you do that? A simple tip you have to remember here is, whenever you sit, you should sit with your feet rested. Number two, you should sit with your back supported. Now, how supported? Support it with a small pillow. So put a pillow behind your low back. First, sit with your buttock completely touching the back of the chair, and then place a small pillow or a small towel roll behind your back. Now, make sure those elderlies whose doctors have suggested to not use something behind their back or not use pillow behind their back due to some back related problems, they should not use it. Okay, they should not use a pillow, because there are certain conditions in the back wherein when your spinal conditions, conditions related to your spine, wherein it is suggested to not use anything behind your back or pillow or so. But for others, other than those people, it is recommended to use a small pillow or a small towel roll or a small fold of towel behind your back, behind your low back. Now, don't keep it behind your buttock. First, sit properly with your buttock sitting the back, sticking the backrest of the chair, and then use a small support. Why is that support? Because your spine is your low back. Our low back is curved, and it needs some support. So when we sit without support, we happen to slouch. Now, once slouch, this curve is gone. We need this curve to be maintained and supported. Hence, use a small pillow to support this curve. Are you all with me? Okay.
Yes.
So,
yes.
okay. All right. So this support is required to support your back. Why your feet should be supported? So that when you're sitting with the feet hanging, your low back muscles, they are stressed. They need to work more. So that is why always remember, keep your feet rested. If your chair is high, supposedly use a foot stool, a small, we can say a foot stool, or we call pata, something of that sort, under your feet, or maybe you can keep a stack of sheets or so that your feet remain supported. Your feet shouldn't be hanging. This you have to remember while sitting. Okay. Now, next, if you have any doubts, we will take questions in the end, definitely, to solve all your doubts. Now, standing, I told you. Now, after sitting, we come to standing. We come to standing posture. How do we have to stand? Now, make sure, as and how we age, there happens that the spine is little bit curved. That's okay. It's an age-related change. That's okay. But as much as possible, try standing erect. Try standing straight as much as possible. So try making your ears and shoulders to be in one line. Now you can stand in front of the mirror and correct your posture. Now whatever I am telling these corrections to you all, as much as possible, you can do which how much ever is possible from your end. Don't overstretch. Don't overstress yourself. Okay. How much ever can you do to start with is always better than doing nothing. So I want you to stand in front of the mirror. Make sure your ears and shoulders are in one line. Your chin is not higher or lower. It's parallel to the plane. Your stomach is not. Now, how this left side female stomach is too much, forward, ahead. So it's not about the diameter of the stomach, the area. The way she's standing is wrong. She just swayed forward. So once you sway forward, your tummy muscles, they become weak, and then your buttock muscles, which are very very important for your spine, they become weak. So we don't want this. Make sure you slightly tuck your tummy, slightly, I meant slightly. Don't pull in too tight so that your breathing is restricted. Understand this. You just have to slightly tuck your tummy in, slightly pull in, maybe 10%. That's it. Make sure you're breathing continuously. You're not holding your breath while you're tucking in. Okay, this is and if possible, slightly squeeze your buttock. While doing any of these things, you should not hold your breath. This you have to remember. Okay, now I want you to try this. I repeat once again. You have to stand straight. You have to try aligning your ears and shoulders in one line, chin parallel to the floor. Try tucking your tummy slightly in 10% and your buttock slightly in 10%. Keep your breathing regular. Don't hold your breath. Keep your feet parallel and make sure that your knees are not too much behind. Okay, it's called as hyper extension. We call it as a medical term. Don't push back. Knee is incorrect. Make sure your knees and your hip are in one line, and your ankle, hip, knees, and ankle. Now, from today, it's a homework. 1 minute, 1 to 2 minutes, 2 times a day, you're gonna stand in front of the mirror and correct your posture and add your beautiful smile to this posture. Will you be able to do this?
Sure.
Will you be able to do this?
Yes, yes.
All right. Yes.
Yes,
All right.
I will do it.
Wonderful, wonderful. So this you have to practice 2 minutes, 2 times a day. Simple exercise. You just have, because your body, we are adapted to incorrect postures. Our brains are adapted to incorrect postures. So when you start correcting the posture, you may feel little discomfort, and you may feel like this is not correct. But then that's okay. Your brain needs time. Your brain needs time to get reprogrammed. So go gradually. Start with 5 things a day. That's okay. All right. So especially ladies at the kitchen, this is the most noticed posture by us. They are engrossed in cooking for the loved ones, and they forget how they are standing for long. So this incorrect posture, they just push their stomach inside out, and then it's called sway back posture, swayed posture. You just let your back and tummy to go ahead, and your knees are pushed back. So this is bad for your low back because there is no support for your low back. You are just swaying it, and after a period of time, then your low back starts paining, and your knee also starts affecting, giving you discomfort and pain. So this picture on the right is the correct, like we discussed. Your shoulder in one line, your hip, knee, ankle in one line, chin parallel to the floor. Okay. So also make sure while you're standing, while you're chit-chatting, maybe you've gone to some function, you unknowingly happen to stand on one foot. One side, you happen to put more weight rather on one leg than the other. Now, this is something which is not recommended because it affects your spine, this called pelvic bone. It affects your hip, your pelvic bone, and your spine till your entire neck, cervical spine. So because it causes imbalance in your bones and muscles and joints. Hence, you are not supposed, make sure you take equal weight on both the feet while you stand. So it will take time. Maybe you will forget, you will go on one leg, more weight bearing more on one leg. But then recall that I have to stand on both the, taking equal weight on both the feet. Okay, you'll be able to do it gradually. Okay. Yeah, this is what I meant. Also, a lot of us go for shopping, grocery shopping, and a lot of things. So while going for shopping, make sure that you carry equal weight on both the sides. So distribute equal weight in two bags, divide equal weight in two bags, and carry it on both the sides. Why? Because when you carry weight on one side, what happens? Your spine gets affected on one side. Your spinal muscles, your muscles on one side, such as shoulder, your one side of the hip joint, and your low back muscles, they get affected on one side more than the other. Then it will not affect you immediately, but after a period of time, it will start giving you discomfort and pain. But we want to stop that before it gives us pain, right? Want to hit it before it affects us, it causes us discomfort. So make sure next time you go for shopping, carry two bags equally in both the hands. Okay. Will you do that? Are you all with me? Is everybody with me?
Yes.
Yes.
Okay. All right. So this is what I was saying, that your feet needs to be rested. I know you don't use computers, but then this picture I specially put up to show how your feet should be rested. Once it is when your feet are not rested, it affects your low back. That's why your feet needs some support. Your low back also needs to be supported, as I discussed. So if your chair has backrest, the chair nowadays sometimes the chairs are also they are already customized in such a way that it provides you back support. If you're sitting on sofa, you need to have support. And one more thing, make sure that the sofa is not too soft, because it doesn't give you support. When your sofa, it should be firm. The sofa which you sit on, it has to be firm, because if it is too soft, it doesn't give you any support, and you just go and your body gets your body accommodates in that soft texture, the soft material. You don't want that. You want your chair or sofa to support your back and joints and muscles. Okay, so your sofa should be firm and not too soft that it doesn't provide support. Okay, so today go back and check how your sofa is. If it is not, make sure that it is firm. It shouldn't be too hard, but it shouldn't be too soft also. It should be firm. Another thing I would like to tell you, nowadays we use a lot of phones. So make sure, while using phones, what happens if you're using phone for long period of time in this position, your elbows, your neck, this part of trapezius muscle, this muscle gets affected a lot. Now, if we think, if we recall, many of us have pain in this area. Why is this? Because using a lot of phone, we happen to poke our head forward. So while being in this position, this muscles, it needs your head to hold back. It works for long, as many hours we hold our phones in our hands and keep working on it. So this posture affects this muscle. incorrect. Poking at posture affects this trapezius muscle. Once this gets affected, you start getting pain at the elbow also, tennis elbow, and then you start getting decurvance because this is the base. If this gets affected, your entire upper limb, your entire hand and joints of the hands will get affected. So make sure, now I've shown in this picture, how do you need to support your elbows with a pillow. Okay, make sure you have some support under your elbow so that your elbow remains supported, so that it doesn't affect your trapezius muscle, and make sure you use it at the eye level. Okay, try and keep it at the eye level or slightly lower. And the most important thing I want to emphasize here is change it. Like we said, after 30 minutes, you have to get up and not sit for more than 30 minutes. So while using your phone, also take breaks. Take breaks after 25-30 minutes, not more than that. Use it at the eye level, because the more you bend it, the more it affects your spine. See how much this. I've shown in the picture. The more the bending, the more pressure it puts on your spine, on your neck, on your cervical spine. So make sure you use it at the eye level. That's number one. Or little lower you may keep your elbows supported with the pillow. Number three, take breaks. Don't be continuously on your phone watching a recipe, watching a movie, or whatever you're doing. Okay, make sure you take break. Taking break from a posture is very important. How much ever good a posture is. So you will say, I'm sitting in a very good posture, but I'm sitting for hours together. Is that recommended? No, absolutely. Even if you're sitting in good posture, you need to get up after 25-30 minutes. Why? Because when you're being in one posture, that particular group of muscles, suppose your back, your thigh, your buttock muscles, they are in that position for quite long. They also need change. They also need to breathe. They also need some change to breathe, for improved circulation. Okay, that is why change of posture is a must, however good a posture is. You need to keep changing. Don't keep standing for long, cooking and forgetting that I need to sit. 25-30 minutes, sit. Keep a chair beside you, keep a small stool beside you. Sit for a minute. For a minute. I am not asking you to sit for hours. 1 to 2 minute break is must if you're cooking. If you're sitting watching TV, 1 to 2 minute break is important. Get up, stand, take a round, and sit. Go for a take a washroom break, take a water break. Okay, so these breaks you can incorporate in a sitting time duration. This is must. This is must. If you have gone for a walk, supposedly walking for long, so if that is giving you, irrespective of whether it is giving you discomfort or not, if it is giving you discomfort, you need to listen to your body and sit for a minute. If not, then also you can take a small break in between to sit for a minute. That is okay. Or at least wait for a minute. So this, listen to your body. How does your body give signal to you? And follow accordingly. Change of whatever, whether it is sitting, standing, I repeat, sitting, standing, walking, change of using your phones, change of posture is very important in all these things. Coming next to this, kitchen work. So when you sit, that maybe chopping vegetables or clearing your grains and stuff. Make sure instead of sitting and bending forward too much, use some high support, some elevated support or surface. Maybe you can use a small stool, or maybe you can sit on chair and keep your plate on the table, so that you don't have to bend forward too much, neither your neck nor your back. Okay, so what does it do? It just prevents your spine from bending too much, your neck from getting loaded too much abnormally and then giving you pain. It prevents your pain. It prevents your body from suffering from pain and problems associated with it. Now, coming to this very important thing, now this I put up specially because people are least aware of this very important problem. People keep their wallets in their pockets. Now, for all the males on the group attending the session right now, make sure you or any of your peers or any of your family members, be female, So any of your family members, make sure anybody keeping wallet in the pocket, make sure that they don't keep it in the back pocket. Why? Because this malaligns your spine. One side of the pelvis bone, your hip bone, and your spine is elevated from one end, from one side. Now, what does it do? It affects in such a way that after a period of time, it starts compressing that area, this side muscles and also the joint. Then at a point of time, it may give you pain. People have pain, back radiating down, no, moving down to the leg, the tingling, pins and needles kind of sensation going down to the leg sometimes. So these incorrect postures, they give you these kinds of pain. You may not realize also that this is the cause. I've been keeping my purse in my pocket since very, very long, and then eventually, at a point of time, then a person realizes that also. If luckily, if that person so we had this patient. Luckily, we got to know after examining his daily activities, we got to know that he keeps wallet in his back pocket, and then because of which he had these problems in the muscles and spine and the disc on that side, and then radiating down, the pain going down, because of which that particular group of muscles got affected, and then the disc, and then the nerve. So this is how this is a little thing, a very fine thing. Keep not keeping wallet in the pocket. Okay, but then awareness, we need to know, we need to be aware of these fine things, simple things, just to keep ourselves away from pain. Now, one very important thing, most of us are, we wonder that what kind of pillow we need to use, what kind of bed we need to use, mattress we need to use. Yes, many of you would have these questions. So today we are going to look that. So while taking pillow, now I want to tell you that when you lie on your back, you may or may not use pillow. It's up to you. If you want, you can use a small towel roll or a small pillow. But when you go on your side, pillow is must. Why? Because when you don't use pillow and when you use a thinner pillow, your head bends to one side. This, just check this first picture. Your head bends to one side. Now the lower muscles, the lower side neck muscle, they get crouched, and the upper side muscle, they get stretched. Now this is bad for your cervical spine, your neck. It eventually causes pain. When the pillow is too high, what happens? The opposite happens. The other side, the lower side neck muscles, they get stretched, and the upper side neck muscles, they get crouched. This is also bad. Now, how it should be? It should be so high that your neck shoulder distance is covered. Okay, it should be of this height, your neck and shoulder. Your head should be in line with your spine, or you can see your chest bone. Okay, and if it is tilted, then your pillow needs to be raised. If it is opposite side, if it is higher, your pillow needs to be lower, needs to be made thinner. Okay, so today check what kind of pillow, how much is the height of your pillow, if it is appropriate, if it is keeping your head and spine in one line. If not, correct it. Now, initially, you may get little discomfort once you change this pillow and pillow alignment, but gradually you will be able to do it. Gradually, you will get accustomed to it. Okay. Initially, you may get discomfort, but still, if it is giving you any kind of pain, or if it is giving you any kind of too much of the discomfort, you may not use it. You may choose to not use it. That's up to you. But this is the ideal way of taking a pillow. Now, how about the mattress? Your mattress shouldn't be, your pillow as well as mattress, both shouldn't be too soft or too firm, as we discussed in case of sofa. It should be firm enough to give you support. And make sure you pull the pillow till your neck. The pillow is not for your head or for your shoulder. Don't pull it too down that it covers your shoulder. Don't keep it too high that it only covers your head. It is for your neck also. So make sure your pillow should be supporting your neck. Okay. The next, because see, these are the simple things which we should know, which we should be aware of, but unfortunately we are least aware. So our goal is to create awareness about posture. This is our aim, and hence we have written a book a small book on posture. It's a handy, it's a simple guide about now whatever things we learned, and we will also learn in this book about the other activities in which we need to maintain our posture. So this book contains it's like a simple guide on how you should be maintaining your posture, and we have also added few quick exercises and corrections about how you should maintain your postures in the other activities of your daily life. So you can order this. This book is available online also, and also you can place an order with us. But then this is a simple guide to keep you away from pain. Why suffer from pain? Physically, emotionally, economically also. Spending a lot of money on pain, money on curing your pain later, when we can prevent this pain earlier at an earlier stage, is the whole aim of writing this book. So this book, it will give you information, it will empower you with the knowledge which will help you to save yourself from pain. You can order it online also, or if you, to make it simpler, you can just send hi on this number, and we will follow you through. For our audience, we have kept it at 20% discount, and we will deliver it to you free of cost. So if you want to order this book, you can just send hi on this number. The book is at the cost of, we've tried keeping it at the lowest possible so that it will reach out to many people. Maximum number of people will be able to get, benefit of it. It may be less than the cost of your glasses. So instead of spending a lot of money on your pain later, we want people to prevent pain at an earlier stage. Okay, and still, if you have any pain or posture related problem, we also so that's my gift for you all today. We provide you one free consultation. If you give a call, if you have any posture or pain related problem, you can give us a call. We'll provide you a free consultation for all our attendees today. So this this give is available for a period of a week. You can contact us at any point of time, be it for a book or for a consultation, to us on this number for a span of week. Now, after this, one very important thing I want to tell you is, now we studied, we learned how do we need to maintain our posture, how do we need to correct our posture and change of our posture after a period of time. While we should also understand that we need to focus on other things, we need to take care of other things also to keep our muscles and our bones strong, such as your food. Eat healthy, fresh food, eat timely, eat at regular, if you're follow your time of meals. That is very, very important. Eat on time, keep yourself hydrated, have good amount of water. Physical activity is very, very important. Go for a small walk every day, and as we discussed, you should not being in one position for long. Sleep, sleep on your time, take good amount of sleep. So all these things, they help you to keep your bones and muscles healthy. Now, one important thing I want to tell you is just correcting your surroundings also. One quick note on this. Now, what do you mean by correcting or changing your surrounding? It means that we have this fear, because of sometimes we have pain, and then sometimes we have fear of pain, sometimes we have fear of fall. Now, to avoid this, if we have fall, then again there is fear of pain. The pain doesn't allow you to do things. You keep yourself keep seated in one position, not moving around. We don't want that. Okay, we don't want you to, the goal is a person should not fall and suffer from pain and injury. So to prevent that fall, what modifications we call it as, now these are especially for elderlies we recommend. What can you do? Now make sure that there is adequate lighting in your home. Okay, and there is no glare. So the lighting is soothing, but there is adequate lighting. Make sure that the things are not falling on the floor. Make sure that the floor is clear of the cords and objects. Keep the objects on their places properly. Don't keep them in the middle, somewhere fall in the middle, so that it creates an obstruction for you to obstruction to you while you walk. Next thing you have to remember is you can use anti-skid mats in the bathroom so that it prevents you from having fall. Make sure that you have grab bars in your bathroom, near your commode, or in your immediately in your bathroom where you can the usable area. So grab bars are very important for you to give. It gives you good support. Next thing, also grab bars at the staircase, at the places where you use more often. Staircases, grab bars at the staircase, grab bars in the bathroom, grab bars in the areas where you move around more often, so that it gives you support whenever you need. Make sure that the edges of the furniture, they are not sharp, so that even if you happen to have maybe some slight collision also, it will not hurt you. So these are the fine things which you need to understand. Make sure that your size of the bed, height of the bed is higher, height of the sofa is higher. It's not too low, so that it causes you less of efforts to carry out your daily activities. Okay, so these fine things are very, very important to keep in your mind. And one very last important thing, to have an optimistic or positive attitude, a positive state of mind, because that is very, very important in keeping our muscles and bones healthy, and in turn saving us from pain. Are you getting me? Are you all with me?
Yes.
Yes. Okay. So for this, I will take 1 quick minute of yours, and then we will go for question and answer session. So it's something which you are going to do called affirmation. So I want you to sit relaxed. Are you all with me? I want you to sit relaxed. 1 minute I'm going to take. Then we will take question answers. Sit relaxed. Everybody is ready? I just want to see you all. Sit relaxed. Sit erect. Take a nice good breath and exhale slowly through your mouth, as if you're blowing a candle. Come on, everybody with me. Take a nice good breath. Breathe in. Exhale slowly through your mouth. One more time. Take a good breath. Exhale slowly through your mouth. That's nice. And now you have to repeat with me. I am blessed with good health. Come on, everyone. I am blessed with good health. You have to speak. Yes. Speak and feel. You have to feel it. Take a good breath.
We
Exhale
can feel
slowly. Yes. I am blessed with good health. Feel it. Come on, everyone. Very nice. Come on. Take a good breath.
With good health.
Good health.
Very nice. One last time. Take a good breath and say, I am
blessed
with
with
health.
good health.
Very nice. And next we have to say that I take care of my health first. Come on, everyone. I take care of my health first. Very nice, very nice. One more time. Take a nice good breath and say, I take care of my own health first. I take care of my health first. All right, all right. One more time. Take a good breath and say, I am awesome.
I'm awesome.
I am awesome.
Very nice. One more time. I am awesome.
I am awesome.
awesome.
All right. One last time. Take a nice good breath and go ahead. I am awesome.
I am awesome.
Very nice. Very nice. Very nice. I'm glad you are so enthusiastic. I am also very happy to see you. So from today, now I just quick takeaways. What we learned in today's session: you need to maintain the right posture. We all discuss how you need to sit with your back supported. Your feet should be well supported. You should take breaks in between, not keep seated for long. You should keep your neck not too much bent while cutting, while chopping, while operating your phone. Keep your elbows supported. While standing in the kitchen
I'm
for your
taking
loved
good
ones and
care
family
of
members. Make sure you have a good posture. Remember your homework. Standing in front of the mirror, taking a nice, beautiful with a beautiful smile. You have to correct your posture. That is important. Keep walk around after a period of time, if you're sitting, standing for long. So these are things which are very important, which you have to follow. Other than that, we learn your timely meals, your sleep, good amount of sleep, water, and taking care of physical activity. You need to go for some small walk, and lastly, a positive attitude, which we learned today. Now this affirmation you're going to practice every day. Okay. Yes, and the modifications, the changes which we learn, the light, the good amount of light, clearing your pathways, having grab bars, raised elevated seats, surfaces, and your anti-skin mat in the bathroom, which will prevent you from having a fall and save you from pain. Okay, so this is our learning for today. I am open for questions. I hope you enjoyed the sessions. You can ask me the questions.
very
Nice.
much, very much.
Very nice.
I want to tell you, I'm getting a terrible pain in my knee. Now, what should I
Any
do?
questions?
Beg your pardon? I'm getting
Sorry,
a
your
terrible
voice is
pain
not
in
on.
my knee.
Madam,
And it's not exactly on the kneecap, it's below the kneecap.
okay. What is your doubt, madam? You have pain below your kneecap.
Yes. And a lot of pain only for the past 3-4 days. It's not exactly
Okay.
at the knee, behind the kneecap. It's underneath. And it's a little burning
Okay.
also.
So there could be now this pain could be now there are multiple causes for such kind of pain. It could be because of the joint, the degenerative age-related change at the joint. That could be one cause, or that could be a strain of the muscle, and a muscle weakness. We call it as the muscles around the knee. When they get weak, the joint gets affected. It's called patellofemoral. We call it as the patella bone. The kneecap. Sorry.
Yeah,
The
kneecap.
kneecap and your, yes, the space between your kneecap and your the rest of the bones, your
The
thigh
calf.
bone and your
The
leg bone.
calf.
Yes. Yes. So then that gets, so because of the weakness of the muscles around these, the bone, the distance between the bone, we call, there is some supporting surface, we call it as cartilage, a disc kind of thing. No, after
But
a
what should
period
I
of
do?
time, when your
What should
muscles
I do?
get weak, the cartilage, it gets worn out,
Yeah.
and then it gives you pain. So for this kind of pain, your muscles, they need to be strengthened well. Okay, you may have to strength. Some muscles, they may be tight, and some muscles may be weak. That is why your back and your buttock muscles may be weak, which is loading your knee also incorrect. So you may have to visit your physiotherapist to get the muscle correction, and then you can start carrying out your daily activity.
Achha. Okay. Thank you.
And one more thing I would want to tell you, for now, since you have pain, avoid stair descending without support.
Avoid what you said? Avoid your?
Going down, coming down the
without,
stairs,
yeah,
coming down the stairs
yeah,
without support. So support yourself
yeah.
with a grab bar or so.
Yeah.
So that
Okay.
it will reduce the stress to the joint.
Okay. Yeah, that I do. Anyway, thank
Any
you.
more questions for the doctor?
Yes.
You can take one more.
Sorry,
Doctor, I think thank you very much for this. This has been really helpful. Look forward to seeing, first of all, again, thank you from all of us, and look forward to having you back on TAARE Social soon. If anybody wants to contact the doctor, she has given her details in the presentation. This will be uploaded also. However, if you still need her number, write to us at TAARE Social and we'll connect you to her. Thank you, everybody, and have a nice day.
Thank you.